Hello, my name is Dr. Elbridge Bills. I'm the founding partner of Alliance OBGYN. My partners, Clement Shao and Todd Bashik, and I are presenting a series of short informational videos regarding various topics in obstetrics and gynecology. This is mainly intended for our patients, but this information is certainly helpful to the general public. Each topic is discussed in broad terms and certainly not applicable to all patients. This is not meant as a substitute for a doctor-patient relationship. Obstetrics: when to call, when not to call. The physician providers of Alliance OBGYN and the solo practitioners that occasionally share weekend and evening call are all board certified or board eligible physicians that are available 24 hours a day for the care of deliveries, obstetrical, and gynecological emergencies. Certain changes occur with your body during pregnancy that are either normal changes or very common and do not require calling the after hours emergency phone line. Bleeding in the first trimester is common. 30 to 40% of pregnancies will experience bleeding in the first trimester. Unfortunately, there is a 15 to 20% chance of miscarriage with any pregnancy. The physicians of Alliance OBGYN perform a sonogram at your first visit and weekly until a fetal heartbeat is seen. After a fetal heartbeat is seen, the miscarriage rate generally drops to 3 to 4%, so seeing the fetal heartbeat is very reassuring. If bleeding does occur, there is really nothing that can be done to stop it, and thus you do not need to call the physician on call, but we would like you to come to the office the next day to perform a sonogram to ensure everything is okay. If you are very concerned about the bleeding, you can proceed to your closest emergency room, and depending on the situation, the emergency room physician may order a sonogram to reassure you. If at any point you are having bleeding more than 1 pad an hour for 6 hours in a row, this is too much bleeding, and we would like you to call the office and proceed immediately to Northside Hospital Sandy Springs emergency room. You may require a D&C. Please do not eat or drink anything on the way to the hospital. You should call us while you're en route to the hospital. Fetal movements. Fetal movements are generally felt by 18 to 20 weeks, occasionally earlier. It will not become regular until the 28-week mark. At 28 weeks, we would like you to count fetal movements every day. We generally want you to be able to feel 10 discrete movements by noon. They don't have to be hard kicks, just a separate movement. If you don't feel 10 movements, please call immediately. This sounds somewhat arbitrary because it is. If you call us by noon, we can have you come down to the office, put you on the baby monitor, and make sure everything's okay. If you call us later in the day, you'll have to go down to the hospital, and this may take significantly longer. Contractions. Contractions are common in pregnancy. In an otherwise uncomplicated pregnancy, you can have up to 6 contractions an hour, and this is normal. After 36 weeks, we would not try to stop labor, and thus when you have hard contractions every 5 minutes for an hour, you should call us while you're en route to the hospital. Labor. Many people are concerned they don't know when they are in labor. You will know. After 36 weeks, we will not try to stop labor, and thus when you have hard contractions every 5 minutes for an hour, you should call us while en route to the hospital. Each contraction is going to be progressively worse. Breaking your bag of water is another sign of labor. This is generally a rather large amount of fluid, but sometimes it is just a trickle. One of the ways you can tell whether it's a bag of water or simply leaking fluid is that the bag will continue to leak regardless of what you do. Urine will stop leaking in a few minutes if you go to the bathroom. If you really think you broke your bag of water, please call us while en route to the hospital. The mucus plug, sometimes called bloody show, is simply a mixture of cervical mucus and blood. This generally means labor may start within the next several weeks. This does not require a call to the after hours emergency phone line. I hope this has been helpful in explaining any questions regarding when to call the after hours emergency phone line.